Okay, so now we're going to talk about gout. And gout is covered starting on page, let me be wrong, page 330. Okay, starts with the pathophysiology of gouty arthritis, and that moves on through page 333. Gout is a type of arthritis due to the accumulation of uric acid in the blood that causes needle-like little crystals to form in joints. In primary gout, the production of uric acid exceeds the excretion capability of the kidneys. Sodium urate is deposited in the synovium, which is around the joint, and other tissues, resulting in inflammation. These patients usually have a uric acid level greater than 7. They will have, it's a systematic metabolic disease. The inflammation is a response to the excessive uric acid in the blood. And this is just a brief slide on the pathophysiology of gout. You can read about the pathophysiology of gout on page 330 on to page 331. But primary gout is the most common type, and it results from one of several inborn errors of metabolism. And at the end product of the purine metabolism, you have uric acid. And it is usually excreted by the kidneys. In primary gout, the production of uric acid exceeds the excretion capabilities of the kidneys. It used to be, or it's still considered the disease of kings. A lot of times it's because of fatty diet. Primary gout affects mostly middle-aged to older men, postmenopausal women. The peak onset for men is between the ages of 40 and 50 years of age, and women, of course, would be in the postmenopausal period. The modifiable risk factors for gout include obesity. There is controlling the hypertension. If you have elevated blood sugars, getting your blood sugars under control. Again, it's called the disease of kings, and that is because a lot of times these patients have a high meat, high seafood, high beer diet. And so decreasing your amount of meat and seafood will be helpful, and also decreasing the amount of alcohol, especially beer, because it's the yeast, the ale, that causes that. Medications are diuretics and aspirin. A lot of times, medications that can cause gout are both diuretics and aspirin because of that increasing of the uric acid in the blood. Non-modifiable is your age and gender, and also that genetic predisposition would also be a non-modifiable risk factor for gout. Secondary gout affects people of all ages. Renal insufficiency, diuretic therapy, crash diets, and certain chemo agents can be the cause of gout. Older adults with cardiovascular disease and other health problems, obese patients, and menopausal women also are at greater risk for secondary gout. Gout has different stages. There is the asymptomatic phase, where it is usually the patient just has the hyperuremic acid levels. The acute gouty arthritis phase is a single joint, usually a great toe. Sometimes it can be in the instep or an ankle or knee, but most of the time it's in the great toe. It is an acute pain. It intensifies in 4 to 6 hours along with stiffness. The joint is red, hot, swollen, and very tender to touch. It's very painful. They cannot touch or move it. They cannot put a shoe or a sock on the foot. They will have fever and chills, and they will have malaise. They will have an elevated white count and elevated sed rate as well. As patients develop chronic gout, you will see they will have white yellowish nodules, evidence in the joints and bursa. and near pressure points. They will have joint stiffness and limited range of motion. They can have like a chalky discharge from these chronic gout little nodules. And these patients are also at a high risk for renal stones or for kidney stones. You can see a picture of these tophi, these little nodules from chronic gout on page 331, figure 1810. Gives a good example of the tophi nodules that these patients get with the chronic gouty arthritis. Diagnostic tests, they'll usually do a serum uric acid level. They'll also do a white blood cell count, which is usually elevated, as well as their SED rate is elevated during that acute attack. Think about the inflammation. Sometimes they'll do a 24-hour urine specimen to measure the BUN creatinine ratios. Sometimes they will aspirate fluid off of the joint. They will start, if the patient has developed diabetes, they will look at a fasting blood sugar, and also they will look at a hemoglobin A1C, because it may be the patient is pre-diabetic, and because of different events, you know, they've crossed over that line, and we could have some diabetes issues, which could lead to for less control of their gouty arthritis. Another thing is you want to do when you're assessing these patients is you want to ask what led up to the attack. What was the patient doing? Was there a change in their diet? On slide 32, we have the pharmacological agents used for gout. Remember that you are going to avoid aspirin and diuretics, as they can precipitate an exacerbation of gout. Again, we avoid aspirin and diuretics. Non-steroidal anti-inflammatories are the drug of choice for these patients, but you avoid them if the patient has peptic ulcer disease. Okay? And you can read through all of these here that discuss the different medications that are used for gouty arthritis. There is a substantial amount of information on each of these medications on the notes section of the slide. Main thing for you to know as far as pharmacological agents for gout is know that NSAIDs are the treatment of choice, and that we avoid aspirin and diuretics, as they can precipitate the exacerbation of the disease. Nutritional therapy and lifestyle recommendations. This is all coming from page 332. It is recommended they're on a low purine diet, meaning that they are avoiding organ meat, shellfish, oily fish with bones such as sardines. You should take time to, when the patient is having an exacerbation of the gout, to see what were they doing, what did they eat differently, so that they can know foods that can exacerbate their gouty arthritis. You want to have them avoid alcohol, especially beer. They should avoid starvation diets or crash diets, avoid dehydration, avoid excessive physical activities. They should avoid drugs that exacerbate the gout, such as aspirin and diuretics. Things that they should do is drink plenty of fluids. They want to increase their urine's pH by drinking citrus fruits and juices. They want to do stress management techniques as well, to lower their stress level, to decrease the likelihood of gouty arthritis attack. Some of the nursing interventions that we've already really mentioned with gout is they want to increase their fluid intake to greater than 3 liters a day. They want to monitor for side effects of medications. During an acute attack, make sure we're doing pain management. Sometimes these patients will require bed rest or at least limited mobility until the acute attack subsides. You're going to elevate that affected joint. You can apply sometimes a cool compress, but generally when the gouty attack is happening, they cannot tolerate it. They want to avoid fasting, avoiding dehydration as well, avoid fad diets, and of course weight loss for obesity, and staying away from red meats, organ meats, and shellfish as well. and beer. Again, if you think about the diet of kings of like Henry VIII's era and what they were able to eat that their other people were not, that gives you a great idea of what people with gouty arthritis should not eat. They should not have lavish, thick and fat, rich foods, because that can cause a attack of their gout. We're going to talk briefly about Lyme disease. Lyme disease is a reportable systemic infectious disease caused by a tick bite with this Spirolactate Bordetella. I'm not going to be able to pronounce that well, but it's basically when you have a deer tick that is infected with this microorganism. Also, and the deer tick is a black-legged tick, and it is the most common vector-borne disease in the United States and Europe. Most cases of this disease in the United States are found in New England, the Mid-Atlantic states, including Maryland and Virginia, and the upper Midwest of Wisconsin and Minnesota, and northern California, especially during the summer. It is a reportable disease. If Lyme disease is not diagnosed and treated in the early stages, later chronic complications such as arthritis, chronic fatigue, memory thinking problems can result. This late stage of chronic persistent stage occurs months to years after the tick bite. For some patients, the first and only sign of Lyme disease is arthritis. In some cases, the disease may not respond to antibiotic therapy in any phase. Prevention is the best strategy against Lyme disease. So because that is the main way that we prevent, the main way to keep people away from Lyme disease is to prevent Lyme disease, I want us to make sure we look at chart 18-14 on page 333. Talks about avoiding heavily wooded areas, and if you are going to walk on a trail, avoid dark colored clothes so that you can see the tick on light colored clothing. Make sure you're using insect repellent. Wear long sleeve tops and pants. They talk about tucking your socks into your boots. Bathe immediately after you have been out and about in the woods. Make sure you're checking your pets for ticks. Gently remove with tweezers or fingers and cover with a tissue or gloves any ticks that you find, and you do not want to squeeze them. Wait 4 to 6 weeks after being bitten by a tick before being tested for Lyme disease. Testing before that time is not reliable. So that's important to know that we need to wait 4 to 6 weeks after being bitten by a tick before we are tested for Lyme disease, because tests before that time are not reliable. We need to make sure that we're reporting any symptoms such as a rash or flu-like symptoms to our healthcare providers immediately. So again, prevention is the best strategy. Make sure you're looking at that chart on page 333. Remember that you do not want to be tested for Lyme disease until 4 to 6 weeks after the tick bite. Make sure you're looking at the different stages of Lyme disease, but mostly look at what some of the chronic persistent things that can cause Lyme disease are. And it's very interesting to me because people will not be tested for Lyme disease because they weren't concerned about it. But years later, when they develop arthritis or they're having chronic fatigue or memory problems, this is usually one of the diseases that infectious disease or a primary care physician will look for. And I know several people who have ended up that Lyme disease was the cause of their chronic fatigue, and they were able to get some relief with antibiotics. But remember, antibiotics may not respond at this stage. And that's it for Lyme disease, and we'll come back with osteoporosis.